This week on Africa Health Check.
They respond really slow, so they should upgrade their emergency services.
But let me say what I think. The training is there, but I don't think that it's enough.
We evaluate our emergency response level of preparedness.
We have to prepare very well, or we have to train ourselves towards. We don't know what will come next, so we have to train ourselves.
And delve into ways to build response capacity of the African continent. Good day and welcome to Africa Health Check, where we reflect on health issues affecting the continent of Africa. I am your host, Jang Paladi. On today's episode of Africa Health Check, we will be discussing emergency health response. And to help me unpack this topic, our special guest for this episode is Dr. Bewa Jawani, who's a medical doctor as well as a development practitioner from Benin. I'd also like to welcome our usual commentators, Dr. Marianne Morethi, the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya. I'd also like to welcome Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. Remember, we are discussing emergency response training, and I would like to just kickstart this show by welcoming our special guest, Dr. Bewa Jawani. Hello, how are you?
Hi, Gigi. Hi, everyone. I'm doing great. Excited to be here.
Thank you so much, Bewa, for joining us for the show. I know that you have a lot on your plate at the moment, so we really appreciate you taking time to contribute to the Africa Health Check conversation. Maybe just to kickstart this conversation, I know you wear a lot of hats locally and internationally, so let me give you the chance to just introduce yourself and just briefly talk about the different roles that you play.
Absolutely. Thank you, Gigi. I'm Dr. Jawani Bewa. I'm a medical doctor and family medicine physician. I also work as a global health consultant, and currently I serve as a research associate at the University of South Florida College of Public Health. I work extensively in Benin and throughout Africa on various health projects and development projects with the UN, with the World Bank, Oxfam, and other organizations. And I'm excited to have an even bigger footprint on the continent and beyond, since I started advising the World Health Organization Africa Regional Director as a member of its technical advisory group on reproductive, maternal, newborn health.
Wonderful. And, usually before we get into the discussion, we like to hear just a background story from our panelists on why they decided to get into that line of work. So maybe just share with us, a young Bewa in Benin, when did you decide you wanted to become a medical doctor?
Thank you, Gigi. And this is actually an excellent question. I decided to become a medical doctor since my childhood because of having myself personal history, of almost dying because of health complications, but being lucky enough to have a provider, a doctor on call to save my life. That was at 9 years old. But ultimately, what also prompted my decision was witnessing the death of my best friend from the complication of abortion due to unretained pregnancy. I then realized that health is not just about healthcare, but it is also about prevention. It's also about public health. It's also about education. So I try as much as I can to merge my role as a medical doctor, as a public health researcher, but also as someone advancing, but also as someone advancing policy work in my country and internationally.
Really inspiring story. And I must say, I know that you mentor a lot of young women in Benin as well as across the globe through the various platforms that you are involved in. So today on Africa Health Check, we are talking about emergency response training. And maybe just to sort of lay the foundation for the conversation, you could just break it down for us. What does emergency response training entail?
This is a very timely question, especially and now that we are going through a pandemic, but we are also witnessing different outbreaks. Emergency response training, I think, is really critical because, our power is in the number, but the quality of professionals that are trained. So training professionals, both medical doctors, humanitarian workers, community leaders, lab experts, and beyond, I think is really critical. And for me, and based on some of my research that I have done with the University of South Florida that I'm also affiliated with, I think it's really critical to disaggregate this type of training based on what is really needed in terms of standards at global level, but also trying to adapt, those training to the local context. From seeing how we can integrate emergency management, controlling, hazard, material, developing national capacities to respond effectively. But even beyond responding effectively, there is a need to have a strong surveillance system in place, contact tracing, prevention measure in place, and making sure that all of those measures are really integrated to the healthcare system. And that's really where, that's where the difference needs to be made. And that's where that's really where we need to make sure that we do invest appropriately in training, not just health professionals, but also logisticians, because we need to make sure that there is no disruption in supply chain when it comes to addressing or responding to a specific pandemic. We also need to make sure that our emergency response target risk communication, which is not fear-based, but which is mainly based on the type of knowledge and behavior that the community needs to take in terms of change behavior and prevent, transmission in the community. I will also add having a stronger medical response, but also looking at social response, because community play a key role in addressing transmission, but also limiting or putting barrier in terms of having transmission in the community. So I really think there's a lot of area. I really think there's a lot of area that we need to consider when we look at emergency response training, but critically, it really has to make sure that all key actors working in emergency preparedness and response are trained according to international standards, but also based on the local reality of each country.
Thank you for that. Really informative. And maybe the next question would be, would you give some examples of best practices where emergency response training has been done effectively and has enhanced the capacity of a healthcare system to be resilient?
Absolutely. There's a lot of examples, and I, want to take, few efforts that have been made in Benin, for example, where I worked a lot in terms of having government, but also actors in the country, taking immediate steps, to train providers and frontliners in COVID-19 contact tracing, in COVID-19 testing, in COVID-19 prevention, including social distancing, but also reinforcing, mask wearing, etc. And I think it really made a difference because community leaders, healthcare community centers as well, were involved and were trained on all of those measures. But we also seen in Africa, throughout other countries, we're also seeing the critical role that Africa CDC has played in terms of really quickly reopening or strengthening or reactivating its emergency operations centers, right, which were really hub regionally and nationally to really advance and speed up response in case of emergency. And I think at the policy level, I've really seen this, the Joint Continental Strategy on COVID-19, which are really building on various areas. But when we look at contact tracing, for example, and how training about contact tracing was conducted, I think it's a positive and key element when it comes to training. And I also want to look more from the research side, because as a researcher as well, my role is to bring evidence and see how our policy program can be evidence-based. And you probably heard, Gigi, about the work that the Africa Science, Technology, Innovation Priority Setting Program have done in terms of engaging stakeholder, program leaders, political leaders in identifying very early on some of the research priorities, but also programmatic priorities that the continent needs to focus on to eradicate or to control the pandemic.
Thank you for that. I'm going to move to Dr. Marianne, because I know this is also a topic that she's very passionate about. Maybe you could just share, Dr. Marianne, from your experience, your exposure, incidences where emergency response training was done effectively positively and contributed to the resilience of a healthcare system?
Yes, so actually within our setting, we've seen this actually work in emergency responses, and we've been quite successful in some areas, despite some of the infrastructural and many other gaps that we've experienced. I can give an example where we had an outbreak of Ebola in Central Africa, and immediately, and the outbreak was announced within our country, especially within the western side of our country, where we border parts of the places that had reported some outbreak. We were able to quickly mount a border response, I can call it that, where any person coming within the country, we were able to quickly check their temperature and take many other clinical history, so that we can make sure that anyone coming within Kenya, coming from that area that had reported some unusual symptoms, we were quickly able to pinpoint who it is and also quickly refer them to a healthcare facility for immediate response. That really worked well because we were able to contain any outbreak within our country, within our borders, and it's fantastic to see such a response. Again, but we have a few, can I call them failures or shortcomings, where we are still dealing with polio. Can I talk about polio? And we have, I think, 2-3 countries within the world that still report polio outbreaks, one of them being Somalia, India, and other areas. And again, because our borders are very porous, can I call them that, we've been unable to miss a few cases that are related to polio. And with that, having a very porous border, we have now these drives where every few months, where in case an outbreak is reported in Mogadishu or Somalia, again in Kenya, within Nairobi, we vaccinate or give the polio vaccination to all children under 5, regardless if we've reported any outbreak in Kenya or not, just responding to what's happening outside our borders. That's really good, so because it prevents any polio outbreak within our country, and also addresses this border security and what else we can do to ensure within our country and also within our continent, we're able to respond to any challenges when it comes to our health security.
Thank you so much, Dr. Marian, for sharing your experience. I'm going to go to Reverend Achampong. You also work in the medical field. Maybe you can just share what are some of the biggest challenges currently being obstacles to achieving emergency response training effectively in our healthcare systems?
I believe that without a good, robust, well-trained and equipped healthcare workers, there can be no healthcare delivery. And so my take on this question is to encourage our leaders, our political leaders, stakeholders, to invest in human development in the health services of our countries. WHO has estimated that for any country to be up in arms with good healthcare delivery, there should be a doctor and patient ratio of 1 to 600 patients, 1 doctor to 600 patients. But in Africa, especially in the sub-Saharan, it is 1 to 50,000, 1 doctor equating to 50,000 patients. And these doctors are normally found in the cities. How do you respond to any emergencies? How do you take care of the health of our people? So one of the challenges that personally I perceive that is actually frustrating healthcare delivery and these emergency responses is not only the building of health facilities and equipping them, but principally also the raising of quality, well-educated healthcare professionals, physicians, laboratory technicians, nurses, and so that who are pumped, who are encouraged to do their best no matter where people are. Because at the end of the day, everybody has a right to good health, irrespective of wherever they live. And so if Africa produces 147 medical schools in Africa, producing so many, and even then many leave to developed countries, then all that we are discussing on this panel is near zero. We can have the funding, we can have all the other things. If we don't have properly, adequately trained and empowered healthcare workers, that will be a non-starter. So let us see this as a challenge and make it a priority as a people in this continent if we really mean to deliver a good emergency response to disease and sickness outbreaks.
Absolutely straight on point as always. Thank you so much for that, Reverend. For now, it's time for us to hear what people on the street had to say.
Yes, the training is good, but our orientation is poor. We don't have hospitals, so when you train them, where will you use them? Most of our healthcare workers are moving to abroad to go and work. So when you train them and they go abroad, they go and work for other people. So I don't think, but the training is very most important to Nigerians especially, because if anyone that is around can really help our society.
There is no way you're going to train, a nurse or a doctor or people, public health, people, and then you fail to train people. You have to train both. Otherwise, you're going to implement things that won't work because people don't understand what you're even talking about. So educate people first, train them, and then bring in these, health practitioners.
We need more training because now that COVID has even taught us a lot that we need because a lot of emergencies were not taken care of. Due to that, we lost a lot of people in our country. So I would say that for now we have to prepare very well, or we have to train ourselves towards, we don't know what will come next. So we have to train ourselves.
Welcome back to Africa Health Check. We've just heard what people on the street had to say. Remember, today we are talking about emergency response training. And earlier on, we're talking about the characteristics and some best practices of effective emergency response training that has been done in various health responses across Africa. Dr. Bewa, we often work with so much terminology when it comes to public health. We have global health security, emergency response, we have universal health coverage, and sometimes it can be so overwhelming and it seems like these are disconnected concepts. I want you to just briefly just rope in all of these concepts on how they are ultimately important and they tie into each other in order to ensure that we realize the health outcomes that our countries aspire to realize by to ensure that we safeguard access to public health for all that is inclusive and equitable.
I think this is an excellent question, Gigi, because, UHC, universal health care, universal health coverage is really important because we want to make sure that people, no matter where they are, no matter who they are, no matter how poor or rich they are, do have access to an essential package of services, both from the prevention side to the treatment side. Now, looking at some of the area or some of the gaps that can be looked into in terms of improvement, I will believe firmly that having a strong surveillance system will be the entry point, a strong surveillance system that can early on detect and alert communities, countries, government, continent, world about threats. Because we've seen with the COVID-19 pandemic that no country is protected, right? If it happens, on the continent, in few weeks, another continent can be affected. So no one is protected. And last but not the least, emergency management system. We are at the era of technology, and we need to make sure that our countries have, reliable, up-to-date emergency management systems so that we can monitor, we can track, and we can follow up regarding and building on the latest standard. And of course, I'm still wearing my researcher hat, evidence, data, to make sure that we can predict the future as much as possible.
Absolutely. And maybe to rope you into this conversation, Dr. Mary Ann, just from your experience as a medical practitioner as well as researcher, what would you say are some of the pivotal gaps that need to most immediately be rectified or addressed in order for our respective countries and different healthcare systems in Africa to achieve global health security?
Yes, so gaps, I can name quite many, but I'll point the most critical ones. One is funding. We need to have enough infrastructure, enough personnel, and that is influenced by how much funds we get. And again, here is where we call upon the government, stakeholders, how much can be allocated in the annual budgets to just deal with global health, because now we have examples of how if we don't address a public health problem, you've seen what can escalate from this economic shutdown and many other things that we've experienced with the COVID. So we can have funding and allocated funds within each country's budget, perhaps that to go a very long way. Again, we need to have more personnel in this sector so that they can deal with any emergencies that can crop up and deal with them very quickly. And then also something I can beat the drum on is the WHO has now set up an emergency preparedness hub within Kenya in Nairobi, and this will address any emergencies, pick up very quickly in case there's an outbreak or any other health security matter that may arise within the continent, and respond even faster within hours. Before, WHO would take up to 20 days before they reach maybe very remote places. So having such infrastructural support from government bodies, from international bodies will go a long way. Then again, communication. We need to communicate effectively, train community health workers right from the ground. Can they communicate to some relevant authority that there's an outbreak or a health security issue or unexplained fevers, maybe within the borders, within the villages, and then escalate quickly so that a response is mounted. Maybe this fever is an unknown infection that may spread and affect the country. So having very effective communication, having more people involved, stakeholders, funding, and also infrastructure support will help us strengthen our global health security, and in particular within the continent.
Absolutely agree with you on that, Dr. Mary Ann. And maybe to go to Reverend, building on what Dr. Mary Ann is saying about the need for funding and capacity gaps, what would you say are the most immediate and pivotal gaps that are needed for us to achieve global health security? But regarding the political aspect and the governance aspect, what are the gaps there and what needs to be done?
Yes, we need regional, local, international coordination, participation in whatever goes on, because sickness and disease outbreaks have a way of spilling over into other areas of any country across borders. So I like the idea of CDC Africa putting regions into groups. In the East African, you have 40 member countries, West Africa, 40 member countries, go to other places where there is conversation and scientific research experiences and collaboration. I do believe that if these can be enhanced, then knowledge can be shared. And when knowledge is shared, responses or solutions come together, and we are able to handle some of the problems that come, in this discussion. I will encourage good conversation, real communication, integration between scientific people, health people on major issues and regional issues, because Rift Valley fever in East Africa is completely different from whatever goes on in West Africa. Lassa fever in Nigeria, you come to Ghana, Guinea, Liberia, Sierra Leone, Ebola, Central America. So regionally, there can be conversation, discussion, communication. And I think that would be one of the headways to break down this polarization and develop a system where all of us together can develop a front to deal with emergency situations.
Absolutely in agreement. And since you're a special guest for today, Dr. Bewa, I'll just allow you to just briefly give us a parting shot regarding the importance of having effective emergency response training as part of our healthcare system to enhance our capacity and resilience.
Gigi, I think capacity building, and I said it and I repeated it, is really critical, right? Because, human resources and workforce development is an integral part of building a strong and resilient health system. And as much as we can, as African country, and a lot of African countries have been showing the way in terms of learning from past experience, both from addressing Ebola or other viruses, but also learning from past experiences and developing and building capacity in country. So I think it's really paramount to make sure that, workforce is developed and that, the knowledge is transmitted. But all of this is not going to be able without sustainable funding. Sustainable funding, not just international funding, but I will also say domestic funding, because Africa has resources. Africa is rich, and, and I'm proud to say that. So also leveraging both domestic and international resources, both government funded, but also private sector, a mechanism, I think it is going to be also very critical. But I also want to put, a critical emphasis on partnership and cross-sectoral collaboration, which will actually really help us leverage and complement our strength, not just programmatic, technical, evidence-based, but also resource mobilization to make sure that some of the gaps and priorities are addressed, but also that countries' capacity and leadership in prevention, early detection, and effective response to infectious disease threats is a reality. Very quickly, I think it's also critical to talk about the importance of the political determinant of health and see how we can, as a continent, really leverage and tap into the political power that our continent do have, both regionally but also on the global scene, and see, how those political determinants of health can be tapped into in country. When we talk about health, we bring on board not just Minister of Health, Minister of Social Affairs, but we also bring on board Ministers of Finance. We also bring on board other sectors that are creating economies and supporting economic development. So I think it's really critical for us to make sure that we do bring some of those key concepts around political, economical, and social determinant of health, and really see how they fit within our preparedness and emergency response. But most importantly, it is really critical to invest in building strong and resilient health systems throughout all the components of the health system. Thank you.
Thank you so much for that parting shot. Really insightful and inspiring, Dr. Bewa Jawani, and for joining us. I think one thing that is just coming out very clearly is that we all have different roles to play as different stakeholders in society, and we need to stand up and play our role in order to ensure that we enhance the capacity of our healthcare system to be more resilient, to be more proactive, to ensure that we have emergency response as well as achieving global health security. It is our collective responsibility. Thank you so much, Reverend Achampong, Dr. Marianne, as well as Dr. Bewa Jawani, for joining us for this episode. Do make sure you connect with us on all our social media platforms. We would love to hear from you, your story, what you're doing in your country to contribute to positive health outcomes for the continent of Africa. Until we meet again, same time, same place, same date. Remember that the future is Africa. The future is today.